Welcome to Chapter 3, The Development of Nursing in Canada. Before Canada became the country it is today, early nursing was performed primarily by Indigenous women. The new colony of Canada was devastated by epidemics and infectious diseases, and so Indigenous women played essential roles within their own and newcomer communities as midwives, nurses, and caregivers. The Indigenous knowledge was used to care for many of the white settlers in Western Canada, and Indigenous people had formalized social structures to care for the ill, injured, birthing, and dying long before hospitals were built and modern nursing was established. As the country of Canada was first being settled, the initial caregivers were just sweet priests, and these were male attendants who would look after the ill and the injured, and there wasn't a lot of medical care done during this time. In 1617, Madame Hebert moved from France with her husband, who was an apothecary, and she was a lay nurse who provided care to the sick and injured people in her area. And despite her husband passing away and her having the opportunity to go back to France, she chose to stay and continue working in New France. In 1641, Jean Matz moved from France to Quebec, and in 1642 she founded the very first hospital in Quebec. Marguerite de Youville formed the Sisters of Charity in 1737, and it's still an organization that exists today. She was actually the first Canadian to ever be elevated to the status of sainthood, and we'll talk about what the Sisters of Charity was on the next slide. Finally, most people came to minister the sick. So people came to New France to minister the sick. This usually was religious organizations that would come and look after the sick. And this was an attempt for them to share their religious beliefs, educate the Indigenous people, and essentially colonize them, if you will. So the Sisters of Charity of Montreal, also known as the Grey Nuns, was created by de Youville, and they expanded across Canada quickly. They gained respect for their work with the sick and supporting people through epidemics. Ultimately, they were the founders of home care nursing and are well recognized for taking care of the poor and sick within their own environments. Florence Nightingale is commonly referred to as the founder of modern nursing. I don't think you'll meet too many nurses who don't know who Florence Nightingale is. Prior to Florence changing how we conceptualize nursing, nursing was often done by lay people and in substandard conditions. So Florence was one of the first statisticians. She would take records of changes and how things were affected. So she was famous for caring for soldiers during the Crimean War, and she dramatically reduced the rates of illness and death with simple changes of infection control and hygiene. And this alone elevated the status of nursing tenfold. So the impact that Florence Nightingale had on the nursing profession doesn't just end with establishing infection control and hand hygiene. The first financially independent schools of nursing were founded by Florence Nightingale, and her nursing schools spread across Europe and North America. Unfortunately, her education model was lost as hospital schools of nursing started to develop in order to fill the demand of nursing. So initially, when considering nursing as a profession, it was considered suitable for white, single women. So patients were segregated based on gender, race, and religion. And students were also segregated in the same manner. So for example, nursing apprenticeship programs often had admission criteria that included that the applicants be white, female, single, or widowed, and between the ages of 18 and 35, speak English or French, and have a good and wholesome character. And this meant no flirting, gossiping, drinking, any of that kind of behavior. And this limited nursing to not include immigrants, Black, or First Nations nurses before 1940. It is evident that this is not the case for nursing today. We have come a very long way, but not to say that there isn't more that can be done to encourage the diversity in nursing. So, like I had mentioned on a previous slide, Florence Nightingale founded the first financially independent nursing schools, but these were quickly overrun by hospital schools. And hospital school students provided nursing care in exchange for education and living arrangements because there was a financial benefit to the hospital because the nursing students did not need to pay and they filled the gap at the nursing shortage. So this often resulted in poor living conditions for the students and provided really questionable education. In the late 1800s, diploma schools started to pop up. So St. Catherine's Training School was one of the first diploma schools, and their admission standards included plain English education, good character, and Christian motives. And the students learned chemistry, sanitary science, physiology, anatomy, and hygiene. And the role of the nurses was to observe patients and report faithfully to doctors. Following the First World War and the influenza epidemic in 1918, university programs become more popular, and university education for nurses was established. And the very first undergraduate program was established at the University of British Columbia in 1919. The Great Depression brought unemployment and hardship to nurses. It affected the financial stability of universities, which made it hard for nursing programs to run because there was not a lot of paid work for nurses. In World War II, there was a significant shortage of nurses, and so there was an increase in funding to manage this shortage, but the working conditions were just awful. In 1939, a committee of labor relations investigated 49 hospitals and found that working conditions and salaries for both students and graduate nurses were awful. For example, nurses were expected to live in with only 1.5 days off per week and 1 full day off per month. The night shift lasted for 1 month with no time off, and there was no overtime pay, no holiday pay, and no sick pay. So the Weir Report from 1932 did a survey of nursing education in Canada, and it confirmed that there was insufficient classroom instruction and a lack of variety in the clinical experience for nursing students. And in 1965, the Royal Commission of Health Services initiated the transition away from hospital training schools into baccalaureate nursing programs in universities. So this slide kind of shows you a roadmap to how we have gotten to this baccalaureate nursing program that you are all in today. So in the 50s and 60s, we've seen a number of programs increased greatly across the country. And there was the first Masters of Nursing program, which was established at the University of Western Ontario in 1959. In the 1960s, there was a transition from hospital schools of nursing to the 2-year diploma programs. And in the 1970s, transition from non-integrated degree programs, so that is universities responsible for theory and the hospital was responsible for clinical, to an integrated degree. So the university has oversight of the classroom instruction and the clinical instruction. So this is what we use today. And in 1975, the Alberta Task Force on Nursing Education recommended that all new graduates be prepared at a baccalaureate level. And so in 2010, all provinces except Quebec endorsed a baccalaureate as entry to practice by 2010. And this is what we are all familiar with today in the very program that you are currently enrolled in. Finally, nursing education today. In response to the evolution of nursing education that we just explored in this PowerPoint, the Canadian Association of Schools of Nursing, also known as CASN, have developed a national consensus-based framework articulating the core expectations for baccalaureate, master's, and doctoral programs in nursing education. Nursing curriculum is constantly changing, and there's been increased access to nursing education through online and distance modalities. And essentially, all nursing programs are the same. So you can go from one nursing program to a different one, and you'll be getting the same quality of nursing education. So the Canadian Nurses Association and provincial and territorial nursing associations all have a registration process across all provinces and territories. So you perform your nursing education, which we just explored in this PowerPoint, and then you'll have registration in both of these associations. So our provincial nursing association in BC is the British Columbia College for Nurses and Midwives. And these associations set the scope of practice for nurses, they protect the title of nurse, and they also protect the public against unqualified and incompetent practice. And the Canadian Nurses Association also has our code of ethics, and so when practicing as a nurse, we have to abide by that code of ethics. So at the end of this program, at the end of your 4 years, you will be a registered nurse, and you will have the qualified nursing education that is recognized across Canada and in our province, and you'll also be registered in both of these associations.